The Vancouver Island Health Authority is working on a plan to provide harm reduction supplies such as needles and crack pipes at a variety of frontline offices. VIHA is considering several dozen potential sites on the island, but some health professionals are questioning the logic behind mixing drug paraphernalia distribution with addictions treatment. VIHA says similar models are working successfully in other jurisdictions, including Vancouver and Europe. This Quadra Street office provides a wide range of addiction treatment services. It is one of 60 possible locations the Vancouver Island Health Authority is looking at to distribute harm reduction supplies, such as hypodermic needles and crack pipes.
Thereby making the supplies more easily accessible and also distributing the venues where people can access it. And that will in turn reduce congregation and some of the law and order troubles we saw at the one fixed site we had in Victoria.
Last fall, the Health Authority announced it was moving to what it calls a distributed secondary model for harm reduction services. The Vancouver Coastal Health Authority has offered similar services over the last 5 years.
We recognize that there are a divergence of viewpoints on this issue. We have a mandate to protect health and to reduce the spread of disease, and we know that harm reduction and access to harm reduction supplies will help achieve that.
I don't think it's an entirely appropriate site to be distributing paraphernalia.
Sue Donaldson manages continuing care programs in Victoria for Cedars Addiction Treatment Centre.
The more we can sort of create environments where people aren't reminded of their active use, the better. The best option would be to have those two functions not co-located, in my opinion.
I don't agree with it. I mean, I've dealt with my own addictions and I had conquered them all through the services of VIHA.
When they go to get their pipes and paraphernalia, that's a good spot for somebody to actually try to outreach or talk to them.
I don't know, it's only going to hurt downtown.
Well, as long as it's for a good purpose, it's out of mind.
If you're going to risk your life getting AIDS or any sort of diseases because of your choices, it's your own fault.
There is an appeal process, and if a site is selected, it may go through a secondary review. VIHA is currently working on its corporate policy and implementation plan. VIHA hopes to begin rolling out its harm reduction plans this summer.